Hi everybody, this is Chapter 1, Part B, and this part of the chapter is discussing anatomical position. There is a position that the body takes that we call standard anatomical body position. And all of the directional terms that we're going to be discussing are referring to the body that is in this anatomical position. The regional terms that we use to designate specific body areas include cephalic. This, by the way, is the anterior or ventral view. Cephalic is referring to the head, where you've got various areas here: frontal, orbital, nasal, oral, and mental, meaning your chin. Then the cervical area on the neck, thoracic area, which includes sternal, axillary, and mammary. Abdominal area, which has quite a few areas to it, but here's the umbilical area around the belly button or umbilicus. The pelvic area, then we have pubic area. Over on the other side, we have the list that includes the limbs. We have got upper limb, which have several terms: acromial, brachial, and antecubital. Then we have antebrachial, meaning the forearm, the carpal, the wrist. Manus is referring to your hand, and there's a couple of different terms here: pollex by your thumb, palmar, and digital, meaning the fingers. Lower limb includes the coxal area or the hip area up here. Then you've got the femoral or thigh area. Patellar is by your patella, which is the kneecap. Crural or the leg area. Fibular or peroneal. This is actually on the lateral side of the leg, outside there. The pedal or foot area, you've got tarsal by the ankle, metatarsal, which are the bones on the top of the foot that you can generally feel, and then the hallux, which is your big toe, digital, which are the toes. This is Table 1.1, which gives a summary of orientation and directional terms. The body is an anatomical position. So the term is over on the left, the definition. The example is shown to you and then described over on the right. Superior is often called cranial. This would be toward the head and or upper part of the structure or body, above. So when we use that term superior, on the human body, it makes sense, it's above. But if you were a four-legged animal, for example, you're not standing upright on two legs. So when we use the word cranial, whether you're standing on two legs or four legs, it's always going to be toward the head, which of course with us is considered superior. So it's toward the head or upper part of the structure or body, and the head is superior to the abdomen. There's your example. Inferior, and again with four-legged animals, we would prefer to use the word caudal because it's referring to the tail. Caudal means tail. So this is away from the head end or toward the lower part of the structure or the body or below. Example, the navel is inferior to the chin. Ventral is also anterior. On bipeds, like human beings, anterior because we stand upright, anterior is the front. A four-legged animal, their belly is down toward the bottom, so that the belly side is ventral. So the definition: toward or at the front of the body, in front of. Example, the breastbone, or at the sternum, is anterior to the spine. Dorsal, this is on us posterior, but dorsal literally means toward the backbone, and again, it's often more useful for four-legged animals. This is toward the back, toward or at the back of the body or behind. Example, the heart is posterior to the breastbone. And then medial, this term is used quite a bit. We use these terms a lot in describing bones, different structure, different features of bones. So this is toward or at the midline of the body or on the inner side of something. Example, the heart is medial to the arm, to either one of the arms actually. Lateral is away from the midline of the body or on the outer side. The arms are lateral to the chest. Intermediate is between a more medial and a more lateral structure. So the collarbone, and that would be your clavicle, is intermediate between the breastbone or the sternum and the shoulder. Proximal. Proximal means closer, closer to the origin of the body part or to the point of attachment of a limb to the body trunk. Example, the elbow is proximal to the wrist. Distal, this is farther away from the origin of a body part or the point of attachment of a limb to the body trunk. The knee is distal, further away from the body. It's distal to the thigh. Superficial, this is external. It's toward or at the body surface. The skin is superficial to the skeletal muscles. Deep or internal, this is away from the body surface or more internal. The lungs are deep to the skin. Regional divisions. There are two major divisions of the body. Axial, this forms our axis, the head, neck, and trunk. The appendicular area would be your limbs or your appendages. And again, here's those regional terms. We just looked at those on the last figure that describes areas seen from the front or anterior. And then here's posterior. The upper limb, we have acromial. There's a process on your scapula right here. It's called the acromion. And that this area then, of course, is called the acromial area. Brachial always refers to the arms. Olecranon means the elbow, in back of the elbow. Antebrachial is the forearm. Manus is hands, and you've got metacarpal and digital areas. The lower limb has the femoral area or the thigh, popliteal. This is behind the knee. The sural area or the calf, and then your fibular or perineal area, perineal, and this is the lateral side of the leg. The pedal or foot. The calcaneus is that bone that makes your heel, so that's called calcaneal, and plantar is the bottom side, or the back, actually, of our feet. But if you think of, I like to think of plantar like I'm planting my foot down into the soil. Here we have cephalic, the head area. Otic is by the ear. Occipital is the back of the head. Cervical, the neck. The back is the dorsal, is also called dorsal. You've got your scapular area, vertebral down the middle, lumbar right here, sacral right in the middle where the sacrum is, gluteal, perineal between the anus and the external genitalia. Anatomic variability. Humans differ externally as well as internally. About 90% of all the structures match. However, nerve or blood vessels may be out of place, or there may be one or more small muscles that are missing. Extreme variations are going to be inconsistent with life. However, minor variations exist all the time. Body planes and sections. A body plane would be a plane that goes through the body in different areas that would divide the body into various sections. Body planes, they go on the X, Y, and Z axis right here. And you can see the coronal plane dividing the body between anterior and posterior. I always think of like a corona around the sun. Goes like around his head, would be like that. Sagittal plane divides the body into left and right. And a transverse plane also, it divides the body into superior and inferior. And it's sometimes this is called a cross, we'd make a cross section that way. So sagittal plane, frontal or coronal plane, sometimes we call coronal frontal. Transverse is also a horizontal plane. The sagittal plane, this divides the body vertically into right and left parts. A mid-sagittal or median plane lies right on the midline and divides the body equally into a left half and a right half. Parasagittal plane would just be somewhere to lateral to the midline, either way, to the right or the left. And the sagittal plane would divide the body into sagittal sections. Body planes, we have the other two. Frontal or coronal plane divides into anterior and posterior parts, producing what we call a coronal or a frontal section. Transverse or horizontal plane, it divides the body into superior and inferior parts, and of course this produces the cross section. That's what I was trying to say earlier. An oblique section, the oblique in anatomy means diagonal. So these are cuts at an angle other than 90% to the vertical plane. And here it is illustrated again. Your frontal plane, mid-sagittal plane would be right down the middle of the body, and you've got your transverse plane right there. And of course we have our Anatomical table, and we see a lot of sections like this. And you can see a frontal section. We can choose which view that we look at our body, and on the Anatomical table. So a frontal section would be through the torso, and you can see a frontal section. Here's a transverse section going through the torso. Inferior view means it's looking up from the bottom, and there are some of these organs identified there. A median section, mid-sagittal section, right through the middle of the body, divides the body into a right and left part. Body cavities, there's actually two sets of internal body cavities. These provide different degrees of protection to your organs. The dorsal body cavity is in the back, and the ventral cavity is in the front, ventral body cavity. So the dorsal body cavity protects the nervous system. There's two subdivisions: cranial cavity encases the brain, and the vertebral cavity encases the spinal cord. And here is an illustration, actually, of both dorsal and ventral. I'll point out dorsal this time. The cranial cavity right here contains the brain, and the vertebral cavity right here containing the spinal cord. This would be a lateral view. Most likely this is a mid-sagittal section right down the middle of the body. And then here we see an anterior view, and you can see the cranial cavity and the vertebral cavity, which of course goes all the way down. This figure comes up again in a minute. The ventral body cavity houses your internal organs. From now on, think of your internal organs as viscera, V-I-S-C-E-R-A. The two subdivisions that form the ventral body cavity are separated by the diaphragm. So above the diaphragm you have your thoracic cavity, and then below you have an abdominopelvic cavity. So the thoracic cavity also has subdivisions. There are two pleural cavities that surrounds each lung. The mediastinum is in the middle over the sternum, and then your pericardial cavity is where the heart is encased. We have our abdominal pelvic cavity subdivisions. There's the abdominal cavity, and then inferior to that would be your pelvic cavity that includes the urinary bladder, reproductive organs, and the rectum. And this is that same figure. This time, figure 1.9, I'm going to show you these. Laterally, you see your thoracic cavity that contains the heart and the lungs. Then you have your abdominal cavity that contains your digestive viscera, and also the kidneys are in there, other organs. Here's the pelvic cavity that contains the urinary bladder, reproductive organs, and the rectum. Anteriorly, we see the subdivisions of the thoracic cavity. Here's the pericardial cavity with the heart in it. It's right in the middle, so we say this is part of the mediastinum. Here's your superior mediastinum cavity, and then there's a pleural cavity over on this side, and there's one over here that surround each lung. The abdominopelvic cavity is illustrated here, and here's your abdominal cavity, and there's the pelvic cavity. There are membranes in the ventral body cavity. They are called serous membranes or serosa. These are thin double-layered membranes. They have these two layers. The parietal serosa lines the internal body cavity walls, and the visceral serosa covers the internal organs, or the viscera. So if you remember these organs as viscera, you will remember that that is called the visceral serosa. These layers are separated by a thin cavity that's filled with serous fluid. This serous fluid is secreted by the membranes. The serous membranes are named for each specific cavity and the organs. So each of them has a parietal and a visceral layer. The pericardium surrounds the heart. You can see that right here. The pleurae surround the lungs, one on each side, and the peritoneum surrounds the abdominopelvic cavity. So keeping the terminology straight, you have the visceral pericardium going direct, it's adhering to the heart. The parietal pericardium is the layer that's out toward the body cavity. There's a little thin layer of serous fluid between these two layers. Here are the here's the pleura, excuse me. You have your visceral pleura that are sticking tightly to the lungs, and the parietal pleura will be adhering to the thoracic wall. Your visceral peritoneum is actually adhering very tightly to the surfaces of your viscera, and then the parietal peritoneum adheres to the abdominal wall. Now this is a nice little visual analogy where it's a flaccid balloon that's demonstrating the relationship between the parietal and visceral serous membranes. So if you took your fist and put it down into a balloon that is not blown up all the way, you would have one layer that's adhering to your hand. So that layer would be the visceral layer. The outer layer, of course, is the parietal layer. And they're showing that in relation to the pericardial membrane, pericardium, parietal pericardium, and the visceral pericardium sticking very tightly to the heart itself. The abdominopelvic quadrants, medical students often, and medical personnel, will be using quadrants, either quadrants or actually 9 separate sections to describe where someone is having some kind of a pain or discomfort. So originally the abdominopelvic cavity would be divided into 4 equal regions. And this is pretty easy to remember. You've got your right upper quadrant. Remember, this is your left is always going to be to the right of someone that you're looking at, your patient. Here's the left upper quadrant, the right lower quadrant, and the left lower quadrant. And just knowing where the organs are in relation to these quadrants, if somebody has a pain in the right lower quadrant, that of course could be an appendicitis, because there's your vermiform appendix. And so often we'll use that. Today with CT scans, computerized axial tomography, that is, MRIs, magnetic resonance imaging, etc., they can often localize any abnormality much easier than just using palpation and auscultation as they used to have to do in medicine. There's actually 9 divisions also that are used primarily by anatomists. And here they are. You've got your, I start in the middle. Here's your umbilical region by the umbilicus. Above, and that would be your epigastric. Gastric refers to the stomach, so it would be like right over where the stomach is joining actually to the esophagus. Right hypochondriac region. This hypochondria gets its name from below the cartilage of the ribs, actually. So here's your right hypochondriac region, left hypochondriac region. To either side of your umbilical region, you have your right lumbar region and the left lumbar region. Hypogastric, which would be the pubic region, is surrounded on either side by your right iliac. The ilium is that upper pelvic bone, which sometimes you can feel that on your, what we call our hip. It's also called the inguinal region because the inguinal canal is right down here. Here's your left iliac or inguinal region right over there. And here it shows you the various organs that are associated with these 9 abdominopelvic regions. Other body cavities. There's other cavities in the body too, but some are exposed to the internal environment. We consider the oral and digestive cavities to be continuous with the external environment, your nasal cavity, the orbital cavities, and the middle ear cavities. Those that are not exposed to the environment would be your synovial cavities. Synovial cavities surround synovial joints, which are your freely movable joints in the body. And that's it. Next we'll be doing Chapter 2. Have a great day. See you later. Bye-bye.